Hi everyone, welcome back to my YouTube channel. Today we are going to talk about dentigerous cyst. So let's start our topic with introduction. Dentigerous cyst is a developmental odontogenic cyst that forms around the crown of an inadapted or developing tooth. It is the second most common type of odontogenic cyst after the radicular cyst. Dentigerous cysts are usually associated with impacted teeth, particularly mandibular third molars, maxillary canines, and premolars. They are benign but can cause significant bone destruction and displacement of teeth if left untreated. Causes and pathogenesis of dentigerous cyst. It arises from accumulation of fluid between the reduced enamel epithelium and crown of an unerupted tooth. It is mostly associated with mandibular third molar, maxillary canines, and premolars. It starts by applying pressure from erupting teeth that obstruct venous flow, and this obstruction of venous flow lead to transudation of serum, and as a result there is cyst formation. Clinical features. Often it is asymptomatic and discovered incidentally on radiographs. It may present with swelling of the jaw or face, by delayed eruption of teeth, by displacement of adjacent teeth, and pain if it is secondarily infected. Large cysts may cause facial asymmetry. Radiographic features. It has well-defined unilocular radiolucency that is surrounding the crown of an unerupted tooth. The borders of this radiolucency are usually corrugated, that is well demarcated borders. It may cause displacement of adjacent teeth or resorption of roots. Histopathology. It has thin, non-keratinized stratified squamous epithelium. Its walls are fibrous connective tissue that sometimes contain odontogenic rest. Inflammation may alter the epithelial lining. Complications of dentigerous cyst. It can lead to infection that lead to pain and swelling. It can cause expansion of jaw and facial deformity. It can cause tooth displacements or root resorption. And rarely a transformation of dentigerous cyst into ameloblastoma or squamous cell carcinoma can occur. Diagnosis. First we do is clinical examination in which we do checkup of swelling and unerupted tooth. Second we do is radiographic examination or imaging that includes panoramic x-rays or CT scans. Third we can do is histological confirmation that include biopsy after surgical removal. Treatment and management. First we do is enucleation, that is complete surgical removal of the cyst along with associated tooth. Second we can do is marsupialization, that is creating a surgical window to decompress the cyst, and it is used for large cysts to preserve adjacent structures. Then there's requirement of follow-up that's by regular radiographic monitoring to check for recurrence. Prognosis. It has excellent prognosis with proper treatment. Recurrence is rare after complete removal, and early detection prevents complications such as jaw expansion and tooth displacement. Conclusion of this lecture video. Dentigerous cysts are common odontogenic cysts that are associated with unerupted teeth. Although benign, they can cause significant complications if untreated. Radiographic examination is crucial for early detection, and surgical management ensure excellent outcomes. Regular dental checkups and imaging play a vital role in preventing long-term complications. And this was all about dentigerous cyst. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment.